Hi, I'm Lainey Yarris, Deputy Editor for the Journal of Graduate Medical Education, and I'm really excited to talk to Dr. Sandra de Montbrun today, who is the lead author on our featured article this month. Passing a technical skill examination in the first year of surgical residency predicts future performance. Dr. de Montbrun, thanks so much for being here with us today. Can you tell me a little bit about your study question and what made you excited to study this area?
Well, thank you very much for the opportunity to speak about this paper. The ability to predict performance is really a key concept in the domain of assessment. Not only do we want to establish that an individual is competent at the time of taking their assessment, but it would be ideal for us to be able to predict their future performance. I'm sure that most, if not all, program directors are not unfamiliar with the scenario of an underperforming resident who progresses throughout their training only to be identified as having deficiencies near the end or at the end of their training. This failure to fail phenomena. So we wanted to see if we could address this issue and if we had the ability to predict future residency performance based on a technical skills assessment given during the PGY 1 year for surgical residents.
As a program director, that problem really resonates with me. What did you find was the most surprising results of your study?
I think we felt that the most surprising finding was that we actually did have the ability to predict future performance. So it's not been demonstrated in the literature that a pass-fail status on a technical skills exam or an otherwise objective assessment of skill has the ability to predict performance. So we were surprised that we really could predict performance, and that performance at a PGY 1 level based on a pass-fail status on the OSATS exam had the ability to predict technical performance in training not only at a PGY 2 level, but even further prediction at a PGY 4 level. So we were really excited at the ability to predict future performance.
Yeah, it seems like the applications for that finding could be really broad. What do you think are the next steps for studying this or furthering your line of research?
I think that there are two main areas that we can further investigate. The first is that the prediction phenomena, so the ability to predict, not only is it applicable to in training, as we've demonstrated in our study, but it would be amazing if we could predict resident selection and if we could even predict performance in independent practice after individuals are certified or graduate. So the phenomena of prediction sort of across the spectrum of training is a further area of research for us. And then the second key concept is if we now have the ability to identify underperformers or people who are predicted to do poorly, we have the opportunity to implement early remediation strategies. But we don't really have a good understanding of what these remediation strategies look like. So further investigation will look at how to develop remediation strategies and how to reassess people after completing remediation to make sure that they've caught up with their cohorts.
We look forward to your ongoing work. Thank you so much for your time today, and congratulations to you and your research team for this exciting paper.